neurological disorders, including epilepsy and Parkinson's disease. So, this is like a brief introduction, the overview of neurological disorders. Neurological disorders encompass a broad spectrum of conditions affecting this central and peripheral nervous systems, and this includes the brain, spinal cord, and nerves. These disorders, such as epilepsy and Parkinson's disease, occur genetic mutations and neurodegenerative processes to autoimmune reactions and environmental factors. And all of these, they manifest through a variety of symptoms, including seizures and so pharmacotherapy remains the cornerstone of managing neurological disorders like epilepsy and Parkinson's disease, aiming to alleviate symptoms, slow disease progression, and improve patients' functional outcomes. In epilepsy, anti-epileptic drugs are critical for reducing seizure frequency and severity, and they also enable patients to lead more predictable and independent lives. So what this neurological disorder, what they really do is they might not really maybe eradicate the whole issue caused by the disease, but they can like manage the symptoms to increase the quality of life of those patients. And so development of targeted pharmacological agents has revolutionized treatment with drugs designed to modulate specific neurotransmitter systems, ion channels, and enzymatic pathways. However, pharmacotherapy is not without challenges, including variable patient responses, side effects, drug interactions, and the need for individualized treatment plans. And its advances in pharmacogenomics and drug delivery systems continue to enhance the efficacy and safety of those treatments, underscoring the pivotal role of pharmacotherapy in the multidisciplinary management of neurological disorders. So, we'll be classifying the neurological disorders and the nations to them. So, neurological disorders encompass a broad spectrum of conditions, like I said earlier, affecting the central nervous system, which is the peripheral nervous system, and also the autonomic nervous system. And they lead to disruption in motor, sensory, cognitive, or behavioral functions. One of the symptoms that you can find with people with epileptic is like seizure. And then these are, for example, like the way it affects the central nervous system, peripheral nervous system, and autonomic nervous system. So it involves the motor, sensory, and cognitive. So the way they behave is also an example of the symptoms. And these others are defined by structural, biochemical, or electrical abnormalities in the brain, spinal cord, or nerves. And like I said, it results in symptoms ranging from seizures to motor impairment and cognitive decline. And then the classification of neurological disorders is multifaceted, and they are often based on etiology, clinical presentation, or anatomical involvement. And then one of those classification is the epileptic disorders, and they are characterized by current unprovoked seizures due to abnormal neural firing, including focal and generalized epilepsy. And another one is neuroinflammatory disorders, and they involve immune mediated damage like multiple sclerosis. And another one is functional disorders, and these include migraines, headaches, and functional neurological disorders with no clear structural cause. So then we spoke on the epilepsy. Then for the Parkinson's disease, and in short form for it is like PD. So PD affects approximately 6.1 million people worldwide, with a prevalence of 1 to 2% in individuals over 60 years. Hmm. So the challenges in targeting pathophysiology. We have the adverse effect and BBB penetration. That's blood-brain barrier, and then pediatric considerations. Um, so the disease progression for the adverse effects cause cognitive or hepatic toxicity, while the Parkinsonism disease drugs induce psychosis requiring careful management. So for the hepatic toxicity, it can damage the liver, like excessive consumption of the drug can affect the liver. That's one of the adverse effects. And it's not common in it's not just like generally in patients. For adverse effects, it can just be maybe like 2% or to 3% of patients you administer the drug to. So it's not you can't really find it in you can't get the adverse effects in all patients. So it differs. And then the goals of pharmacotherapy in epilepsy. The primary goal of epilepsy pharmacotherapy is to achieve complete seizure control without compromising quality of life. Ideally, with minimal or no effects. So there might not be side effects, and the side effects can also be minimal. This involves the adverse effects to the patient's seizure type, epilepsy syndrome, and individual characteristics such as age. So age can also contribute to it, to the level of adverse effects that the patient can experience, and lifestyle can also contribute to this. The secondary goals include reducing seizure frequency and severity in drug resistance cases, preventing long-term complications like status epilepticus, and addressing psychosocial impacts such as stigma and cognitive impairment. So one of the psychosocial parts of epilepsy is the fact that they have to face stigma, and then introduction to so that's for epilepsy. Introduction to Parkinson's disease. Parkinson's disease is a progressive neurodegenerative disorder characterized by the loss of dopaminergic neurons in the substantia nigra pars compacta, resulting in motor symptoms such as bradykinesia, rigidity, resting tremor, and postural instability. So beyond motor impairment, PD encompasses, which is the Parkinson's disease, it encompasses non-motor symptoms, including cognitive decline, depression, autonomic dysfunction. and sleep disturbances. And the risk factors include aging, genetic mutations, environmental toxins, for example, pesticides, and head trauma, while protective factors like caffeine and exercise are under investigation. So the treatment strategies and guidelines. The pharmacotherapy of PD is guided by evidence-based guidelines from organizations like the American Academy of Neurology, Movement Disorder Society, and National Institute for Health and Care Excellence. So all of these organizations, they contribute to treatment strategy, and they create a guideline. And in advanced PD, combination therapies are common to manage motor fluctuations. So, the conclusion of the pharmacotherapy of epilepsy and Parkinson's disease employs anti-epileptic drugs like lamotrigine to achieve seizure control in 60 to 70% of epilepsy patients. And despite advances, challenges like drug resistance, motor fluctuations, and limited access in low and middle income countries persist, underscoring the need for continued research into the gene therapies and digital health solutions to address these gaps.
All right, thank you very much for the presentation. Please, can we give a round of applause? I have one or two things to say. Um, the topic says the pharmacotherapy of neurological disorders. You did not really talk about the pharmacotherapy of these things because you are just talking about the importance. It's more of the importance. I would expect you to go deep to the at least say one or two things about the pathophysiology of each of them, starting from the epilepsy, the Parkinson disease, what exactly can cause them, and what is the disease progression. Then you now go to the pharmacological agents used in the management of these diseases. You talk about the agents and how they are used. This is what pharmacotherapy is all about. But you look as if you just scratched this. In fact, you would not treat this topic. Yeah, you did not treat this topic. No, therapy of neurological. Talk about the pathophysiology. Talk about the agents used and how these agents are used clinically in managing this disease. You do not do justice to it. In fact, you would not treat this topic. And I am not comfortable with it. I will not deceive you. I will not deceive you. I'm not comfortable with it. You would not treat the topic. All right. Thank you very much for your audience. We please stay with us. We'll come back for the next presentation. God bless you.